We're continuing to talk about new Idaho laws that will start in less than a week now on July 1st. So far, we've covered what new rules will impact education, housing, and recreation. But today, we're talking about new laws that will affect your health care. If a child tells their teacher or counselor that they want to change their gender, they must report that to a parent or guardian. The new law goes for healthcare providers, educators, and child care providers. They also cannot help facilitate a child's medical sex transition or social transition. So that'd be like changing the name that they go by without getting a parent's or guardian's consent. That teacher or counselor must tell a parent within 72 hours of a kid's request. If they do not, the parents or attorney general can sue them for up to $100,000. The next law puts limits on which healthcare providers can take part in Idaho's Medicaid program. The Merit-Based Healthcare Act prohibits the use of DEI-related employment, training, and policy. Providers must hire solely on merit, professional qualifications, and clinical competency. If a provider or healthcare facility violates this law, they'll receive a notice with a chance to change their practices before being fined $10,000 for their first offense. Next up, a new law for people battling cancer could help them save thousands of dollars. When it comes to cost sharing between the patient and their health insurance, insurance plans must now treat cancer medications taken by mouth the same as IVs or injected cancer treatments. Previously, oral medications were categorized under prescription drugs, resulting in higher out-of-pocket costs for patients with cancer. A law created in response to the death of a 12-day-old baby boy will soon take effect. Benji's Law will require that when a mandatory reporter files a child protection report for an infant, child welfare workers must conduct a safety check within 12 hours if that child's parents have a documented history of abuse. The law does not authorize automatic removal of a child, only that someone shows up and gets eyes on kids sooner. Catching hearing loss early. A new law creates statewide standards to screen hearing loss in babies as soon as possible. In order to be released from the hospital, baby's hearing must be tested. And if a birth happens outside of a hospital, parents have 21 days to bring their baby into the hospital to have a screening done. Those results must then be reported to the Idaho Educational Services for the deaf and blind. Again, those laws take effect July 1st, Wednesday. If you're curious about all the other laws taking effect on Wednesday, just head to ktvb.com, where we posted the other stories we've done on that.